It's one of the first of its kind in Edmonton, a licensed psychedelic-assisted therapy treatment clinic. And psychologists say this frontier field of mental health treatment is already showing promising results.
Imagine that it was a dosing day. We'd be in this room, perhaps, here, and so there would be, for example, myself sitting on this side, and there would be another therapist or a professional sitting on that side, such as a nurse, and we're here to support the individual throughout their entire dosing day, from start to finish.
In order to get a dose of psilocybin, ketamine, or MDMA, patients at Reunion Psychedelic Therapy in downtown Edmonton must get a referral by a clinical professional and meet eligibility requirements after consulting with psychologists. While on a psychedelic dose, patients in this room are guided by medical professionals meant to treat issues like treatment-resistant depression, anxiety, PTSD, and end-of-life anxiety.
To go inward and encounter different kinds of experiences, memories, or emotions, or thoughts that perhaps they've really been struggling with. Different kind of traumatic experiences perhaps start to come to the surface.
Dr. St. Arnaud says the research on psychedelic-assisted therapy dates back to the 1950s and its use recorded in human history thousands of years before, but despite that is still an emerging field of clinical treatment. Alberta, the first province to regulate the practice in 2022.
Under what we've put together here, this is protecting individuals from unregulated individuals providing, non-evidence-based therapy.
Researchers at the University of Alberta tell me while promising clinical results around psychedelics started showing up a decade ago, there are still questions around their use.
And they seem to create new nerve pathways and help nerve growth in ways other drugs don't. And that makes them potentially very exciting. There is a huge question about, do you need the psychedelic effect to actually have a therapeutic effect?
Dr. Silverstone adds after a few more years of research into their clinical use, psychedelic substances could be a more common treatment for severe PTSD and depression.
So I think it's very exciting, huge potential, but would I say it's ready for prime time? Not yet. We're getting there.
But here at Reunion, they're stressing that they will always follow a psychedelic session with therapy.
So then the work certainly proceeds there. So it's not all about just having these, amazing, fantastical experiences. It's really about going to work and making them into something useful therapeutically.
Reporting from Edmonton, Darcy Ropchan, City News.